Well, hey guys, in today's video, we're going to discuss what it is birth control does to your skin, the benefits and the negative consequences. Online, on social media, there is a ton of misinformation circulating around about birth control pills. So in this video, we're going to talk about how it impacts your skin health. To be clear, this video is not meant to be a substitute for the treatment advice of your healthcare provider. It is merely for educational purposes only. Before getting into the topic, make sure you give this video a thumbs up if you like skincare content from a board-certified dermatologist, and be sure you're subscribed and you have your bell notifications on so you can be the first to know when my videos go live. Just like skincare products, birth control pills, they're not going to have the same outcome in all people. It's very individualized. What works for one person may not work for another person. Birth control pills that we use in dermatology for skin benefits are those that include a combination of both an estrogen and some form of progesterone. This is in contrast to progesterone-only birth control pills, and I'll explain a little bit as to why those differ in terms of outcomes in the skin in a moment. Many women benefit from birth control pills because either they have an excess of androgens, which are the male hormones that we all have, or their skin or hair follicles are a lot more sensitive to those androgen hormones, and birth control pills can help to lower those or lower the accessibility of them. Androgens, which are the male hormones, are produced in women in the ovaries and in the adrenal gland. Birth control pills can lower production of androgens in both the ovaries and the adrenal glands in women. Ultimately, that's going to have a benefit in terms of the skin and hair symptoms of androgen excess. They also lower a woman's free testosterone, and they raise something called sex hormone binding globulin. Sex hormone binding globulin basically binds free testosterone, lowering the amount of testosterone available to impact your hair and your skin. Birth control pills also can inhibit the enzyme 5-alpha reductase. What the heck is that? This is an enzyme that converts testosterone to its more potent form, dihydrotestosterone. Dihydrotestosterone is what is responsible for a lot of skin problems, especially in women who have signs of androgen excess, things like hair loss, hair growth in an undesirable location, oily skin, and acne. Recently, I did a whole video discussing hormonal imbalance in women, and I'm going to link that in the description box. Check it out if you are dealing with any of these signs and symptoms. I go over when it may be a good idea to have blood work checked, what blood work is being checked, so check that video out. But not all birth control pills are the same. At the beginning of the video, I pointed out that in dermatology, we select birth control pills that combine estrogen and progesterone, because there are another type of birth control pills that are progesterone only. You may be aware of the progesterone only mini pill, but not all birth control pills do these things. So the ones that we choose in dermatology that do these things are those that are considered combined oral contraceptive pills. There are also a variety of other things besides pills that can deliver these types of hormones, patches, rings. Progesterone only actually can have more androgenic side effects. So do the opposite of what you're looking for. It can worsen acne, it can make you oilier. Some of the benefits that you may appreciate if you are put on a birth control pill that has that estrogen component to it, a combined oral contraceptive pill, it actually can improve oiliness. Why? Well, oily skin often is a result of maybe either your follicle is very sensitive to the androgen hormones, or you have elevated amounts of androgen hormones, like free testosterone is elevated. That gets converted to that potent form, dihydrotestosterone, and that can ultimately influence sebum production and lead to oiliness. So you may just notice that your skin is less oily, less greasy, shiny. And as a result of that, if you have acne, the acne can improve. It improves because that free testosterone is lower and you have less overall dihydrotestosterone impacting the hair follicle because of inhibition of 5-alpha reductase. So that ultimately is going to decrease sebum production, and it's going to help with acne control. You can expect anywhere between 40 to 70% reduction in the number of acne spots when going on a birth control pill, which can be huge. And as a reminder, acne is a lot more than a cosmetic concern. First of all, it can go on to scar if left untreated. That scar is permanent, disfiguring. It can be very painful. And we know that acne has a tremendous impact on an individual's self-esteem, sense of self, overall quality of life. Women who have acne into their adult years report not feeling as confident and struggling in their interpersonal relationships, including their professional relationships, suffer due to feeling either inadequate or being perceived as perhaps juvenile because they have acne. Birth control pills can kind of also level out the hormones and minimize those fluctuations in hormones. I mentioned an improvement of oiliness, but there is an oily skin condition that a lot of women suffer with. It's called seborrheic dermatitis. You get red, oily patches like on the forehead, the eyebrow area, around the nose, around the mouth. Anywhere actually where you have hair follicles, you can have seborrhea and seborrheic dermatitis. It's flaky, scaly, and it can be very difficult to control, and it's related to excessive amounts of oil being produced. Oral birth control pills can help slow that down and ultimately improve the skin. The end result is going to be clearer skin and just overall perhaps better control of the seborrheic dermatitis. Related to seborrheic dermatitis is a scalp condition that you probably have heard of called, well, seborrheic dermatitis, but on the scalp it is dandruff. You get oily patches in the scalp that are very flaky, and a lot of people think the flakes mean the scalp is dry, but in reality it's due to the oils in our scalp plus a little yeast that thrives in that oil called malassezia, and your immune system mounts a response to that yeast getting a little bit too comfortable, so you get these red, scaly, flaky patches of dandruff. If you're somebody who finds that you have really greasy, oily hair, you're always reaching for dry shampoo, you tried to eliminate shampooing your hair because somebody on the internet told you that that would help your hair not be as greasy. That's a lie, by the way. You may find actually that the oiliness in your scalp and your oily hair improves when going on a combined oral contraceptive pill due to reduction in sebum. Your scalp has the highest number of sebaceous oil glands, much higher than like your arms and legs for sure. It's going to be on your scalp. So scalp hygiene is a way to stay on top of that, but you can appreciate an improvement in scalp oiliness when going on an oral contraceptive pill. Many women deal with a condition called PCOS, polycystic ovary syndrome, and this is due to perhaps an elevation in androgens, hyperandrogenism. That's a mouthful. Hyperandrogenism, elevated androgens. And it can have a variety of effects for the total body health, irregular menstrual cycles, infertility, an increased risk of diabetes, an increased risk of high blood pressure. A variety of health effects can come with having that condition. When we're talking about dermatologic manifestations of that skin condition, I already touched on acne and how birth control pills can improve acne, but birth control pills also can improve hirsutism, which is hair growth in areas where a woman may not want the hair to grow, like the face, the chest, the neck, the abdomen, places where men grow hair, body hair, that women typically don't. It's driven by more androgens. The follicles there respond with terminal hair growth that's coarse, and it can be very tricky to control. Many women have to seek out laser hair removal. Birth control pills can help slow that down, decrease the amount of unwanted hair. While you're growing hair in a way that you don't want on your body, your face, in contrast, on the scalp, you end up, many women at least, with PCOS especially, they end up with what is called androgenetic alopecia. That is a type of hormonal hair loss in which the hair follicles are very sensitive to these androgen hormones, and they convert to a little baby vellus hair. Starts out with the central part getting much wider, and you get hair loss. Fortunately, it's not a scarring type of hair loss, so if we're able to step in and block this process, you can get hair regrowth. I have a lot of videos on this channel about androgenetic alopecia, how it's treated, different types of treatment, so check those out. I have a whole video on hormonal hair loss. We go over spironolactone and medication and how it can help that too, but birth control pills definitely can help with androgenetic alopecia. And importantly, I mentioned spironolactone. Some types of birth control pills actually have something called drosporone in it, which has spironolactone-like effects in terms of its anti-androgen properties that likewise can be very beneficial for reducing acne, improving hirsutism, improving androgenetic alopecia, and for improving seborrhea or excess oil production. An unexpected benefit of birth control pills that do have an estrogen component to them is actually an anti-aging effect. Estrogen in a woman's skin plays a key role in the production of healthy collagen. And we know that with age, collagen production declines. And the decline in collagen production in women also goes along with age-related decline in estrogen production. For example, around menopause and with menopause, levels of estrogen decline, and that is when you can begin to see a lot more wrinkles. While cumulative lifetime exposure to ultraviolet radiation that destroys our collagen and impairs our body's collagen healing abilities is a major driver for wrinkles, in women we have the addition of loss of estrogen that removes some of the pro-collagen benefits in a sense. So being on birth control actually long-term may help in ultimately reducing wrinkles that form, provided of course you are protecting your skin from the sun, which is likewise going to destroy your collagen. But yeah, that is actually an added kind of perk. Women who go on oral contraceptive pills often appreciate just that their skin is a lot softer, glowier, and for that reason, many find it beneficial. But it's not all sunshine and rainbows with birth control for your skin. One adverse effect for your skin is it actually can worsen hyperpigmentation, and it can definitely worsen or trigger melasma. So that is definitely a problem that can happen. It doesn't happen to everyone for sure, but if you already have melasma and you're already struggling with it, birth control pills can make that much worse. With birth control pills as well as hormonal IUDs. An IUD is something that actually goes inside of you and it releases, some IUDs release some amounts of hormones, and those hormones actually can contribute to melasma as well. Birth control pills, while they can have these benefits for your skin that I've outlined here and improving perhaps androgenetic alopecia as well as hirsutism, they also offer the benefit of if you have issues with your menstrual cycle, they can help improve that for some women. Not everyone responds that way. And they also offer pregnancy prevention, but they're not 100% without risk. No medication ever is. And there certainly are risks with birth control pills. This is one reason why they're not going to be right for everyone. One of the main risks that we think about in terms of if birth control pills are going to be right for a patient is it does increase your risk of developing blood clots. It's a very mild increased risk of blood clots, especially if you are otherwise healthy and active. Where we get more concerned for the risk of blood clots are in people who smoke, because they are already at a much greater increased risk for developing blood clots. Add in the estrogen hormones, it can put them at an even greater risk. People who have undergone a surgery where they have to be immobilized for a long period of time, they are at much greater risk for developing blood clots. In fact, if you have ever had a surgery like that, you know they come in and they put these devices on your legs to kind of reduce the risk of blood clot formation. They're called SCDs. And you know, a variety of things you're instructed to do to minimize blood clot risk. You're put on blood thinners. So that would not be an ideal situation for birth control pills. People who have high blood pressure also may be at an increased risk for blood clots on birth control pills. And those who are diabetic. I have seen posts online, social media posts, saying, get off birth control, it will cause cancer. Whoa, that is pretty misleading and not exactly correct. But can birth control pills increase your risk of cancer? Possibly slight increased risk for breast cancer. The risk of breast cancer from a large collaborative study showed a relative risk of 1.24 of breast cancer on birth control pills. Interestingly though, research demonstrates a risk reduction for other types of cancer. Endometrial cancer, which is your uterus, ovarian cancer, and colon cancer have a reduced risk of those with birth control. All that to say, I don't want to dismiss anybody who has ever gone on birth control pills and had some negative side effects and felt as though they're not right for them. I think that's really important to listen to your body and have the discussion with your doctor about the symptoms that are going on that you're experiencing if you are having any negative side effects. What are some of the more common negative side effects with birth control pills? It can make your periods irregular and spotty. It can also cause breast tenderness. In some people, it does cause weight gain, but some people find that their appetite increases. Birth control pills can certainly make you nauseous as well. Definitely discuss with your doctor that you are having these symptoms. In some cases, tweaking the birth control pill type, the relative amounts of these hormones actually can help improve the symptoms so that you no longer have them. Who should not go on birth control pills? If you are pregnant or breastfeeding, not the time to be on birth control pills. If you have very high uncontrolled blood pressure, a history of stroke, a history of blood clots, if you have recently had a surgery where you were immobilized for a long time, if you are a smoker and over the age of 35, if you are someone who gets migraines that are accompanied by something called an aura, which is a symptom of a migraine. You see stars, lights, or maybe you hear a sound. You have some symptoms like maybe a droopy face. Some people's migraines are accompanied by certain symptoms taken together in the presence of birth control pills may put you at a greater risk for adverse effects. If you have a current or past history of breast cancer, again, due to that relative risk increase of breast cancer. If you have any liver disease or liver tumor, or if you have cirrhosis, not great for being on birth control pills. All right, so those are some of the major contraindications who shouldn't take them. But otherwise healthy women, birth control pills, they're safe. Of course, they do have potential side effects and nothing is ever 100%. But I want to make this video so that you guys can understand some of the benefits of birth control pills as well as some of the adverse outcomes related to them. So on the end slide, I'm going to put my recent video talking about hormonal imbalance, going over the different blood work that is checked, signs of androgen excess. So check that one out, especially if you think you may be dealing with something like PCOS. I go over a lot in that video as well. But if you guys enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.